Welcome back, Dr. Ibe Nathans. Just like as I promised, let me give some advices now on this platform. I do a lot of medical education, medical seminars, medical talks in some part of the world. I do that regularly, 3, 4 times a year by God's grace. And when I do these talks, I tell people that the the body, your body is yours. Your body is yours. Nobody has the right to touch your body or to put any needle in your body without your permission, without your consent. So that is one. And secondly, it is really wrong for you to be given medications without being told what they are, without being told what they are for, without being told about the possible side effects or complications. I find it quite bizarre when I talk to some people, even people who are learned, who are educated. I ask them, what did the doctor give to you? He or she will say, well, I don't know. It was in this envelope, in this pack, no names were there. That is actually very wrong. You have the right to know what has been given to you, what is given to you, what they are for, the possible side effects and complications. When I dispense medications to my patients, I would have to let them know what they are for, and I equally give them the literature. I mean, even if the doctor doesn't know or doesn't tell you what the complications are or what the side effects are, if you get the name of the medication, you log it online, log it in online, and in the internet, that will give you the profile of the medications, what they are for, and the side effects. Just like I mentioned a week ago or so, that my patient, by the way, that was having cough on Ramipril, she stopped the medication. She called me yesterday. The cough has subsided and it's almost stopping because cough, as we mentioned, was one of the side effects or is one of the side effects of Ramipril, what you call ACE inhibitor. So basically, you have to know what has been given to you, what medications given to you, and what they are for, and the side effects. And when you are being told that you've been diagnosed with ABCD disease, you also have the right to know how that came about. How was the diagnosis made? Were there investigations? Were there anything carried out, or is it just a working diagnosis or presumption? You have to know how the diagnosis was made. You don't just go with that and assume or agree with whatever you've been told without a proper investigation. And secondly, if you go to the hospital, as long as you can eat and drink, you don't have any uncontrolled vomit, diarrhea, you're not using fluids, liquid, it is questionable just to be on the drip all the time because I've had patients who developed stroke on drip or developed complications on the drip because if you give a normal saline, which is salt and water, in somebody who's hypertensive, you increase the blood pressure so badly that can then cause stroke. If you give a glucose drip on somebody who's already diabetic, the person will get into what you call diabetic coma and the person can die. Okay? So, as long as you can eat and drink, you don't have any vomit, any diarrhea, drips can be questionable. I'm not saying that drips are not needed sometimes. They are needed when the person is highly dehydrated, when the person can't keep down any fluids, any liquid. Yes, it can be given. Drips can be given. There's room for that. However, you need to really make sure that the drips are given to you based on the indication, based on the needs. Okay, so yes, this is what I always tell the people I talk to in my seminars, in my medical talk shows. You have the right to ask questions, ask your doctor questions. Doctors are not mini gods. They are not God. They don't have the last answer. It says, ask questions. If you're not happy with that doctor, change your doctor. You need to know what you are putting into your body. You have to be given the names of the medications, so that you yourself can then look into the indications and the possible side effects. Okay? You need to know how your diagnosis were made, how it was made. Don't just assume or take that as a law. Once again, in this period of COVID-19, take care of yourselves, of your loved ones, be good, and stay safe. God bless. Bye.